Bismillah. Yeah. Hello and welcome back. Now let's move to the fifth code in our 12 codes of code solvers of ECG interpretation. تاني معلش. Hello and welcome back. Now let's move to the fifth code of our 12 codes in ECG code solvers, which is the cardiac axis. At the level of this course, here I want you to differentiate between the normal axis of the heart, presence of left axis deviation, or right axis deviation. At first, what is the meaning of cardiac axis? Cardiac axis means the electrical position of the heart. I mean, is the heart in its normal position in the chest, which is in the center of the chest in the mediastinum, with the apex slightly shifted to the left side, which is the normal position, giving a certain ECG criteria or characteristics denoting presence of normal axis of the heart. Or the heart is shifted to the left side due to left ventricular hypertrophy, or anything that pushes the heart upward, making the heart more vertical, like presence of ascites or pregnancy, giving a new position which is called a horizontal heart. And in the horizontal heart, the heart is shifted to the left side, so it produces a left axis deviation. Or if the heart is shifted to the right side and go away from the left side, here the most common situation is presence of emphysema, or what we call COPD, chronic obstructive pulmonary disease, which push or compress the heart and shift it from the left side towards the right side. In this situation, the heart becomes vertical and its axis change from normal position to the right side, so produces a right axis deviation. So in the cardiac axis, we have normal cardiac axis, we have a left axis deviation, and we have also right axis deviation. In order to determine the electrical axis of the heart using the ECG, we will use some images or some electrodes. One electrode that images the heart from above, and the other electrode that images the heart from below. Here, we will choose the above electrode, which is lead one, and the lower electrode, which is AVF, which is AVF. So when, as a general rule, when the heart go towards one electrode, it makes its electricity to be more positive. And when it moves away from the other electrode, it will make the electricity in it more negative. Let's see this. Let's start with the normal axis, in which the lead one and the AVF both are positive. So this is the normal axis of the heart. Lead one, which is the above electrode, my above camera, and the AVF, which is my below electrode or my below camera, both are positive. So this is the normal axis of the heart. But to determine the axis, look at lead one and AVF. You will find lead one positive and AVF also positive. What about electrically horizontal heart? I mean that the left ventricle become hypertrophied or increase in its size. The most common situation if left ventricular hypertrophy, as in patients with hypertension or patients with aortic stenosis, or some situations that push the heart from below, like presence of ascites or morbid obesity, or in pregnant ladies. This will push the heart to the left side. So it will make the heart to move more toward lead one. So lead one will be more positive, but it will lead the heart to move away from AVF. So here AVF will be negative. So if you look in the left axis deviation, you'll see that lead one is positive as normal, but AVF is negative. So both leads looks like they are in a conflict between each other. They are in opposite directions. So here it is a left axis deviation. If you look here at this ECG, you will find lead one positive, AV if negative. They are looking at opposite direction. Looks like they are in a conflict between each other. So they are from the left-sided people. This ECG has a left axis deviation. The different causes of left axis deviation includes left ventricular hypertrophy, mechanical shift due to presence of ascites or elevated diaphragm as pregnancy, also in presence of left bundle branch block. These are the differential diagnosis between these situations. And here to differentiate, you have to do an echocardiography to determine if there is left ventricular hypertrophy or it is a normal chambered heart. Also, later on in this week, we will know the left bundle branch block morphology. Okay, then we will move to the presence of electrically vertical heart. Here, like presence of emphysema, pushing the heart towards the left side, away from towards the right side, away from the left side. Or presence of dextrocardia in which the heart is facing cardiac apex to the right side, or presence of any situation that causes right ventricular hypertrophy, making or changing the electrical axis of the heart to the right side. Here, the heart goes down towards the AVF, so AVF will be positive, and it goes away from lead one, so lead one will be negative. So here, lead one will be negative and the AVF will be positive. So both leads look to face each other. Looks like they are shaking hand with each other. So they are good people. They are right people from the right side. So this is the right axis. Let's see the ECG. If you look at lead one, the above lead, where the heart moved away from it, so it is negative. And the AVF, where the heart moves towards it, is positive. So both QRS in lead one and AVF looks like they are facing each other. They are shaking hand with each other. So it is right axis deviation. But also we have an extreme right axis deviation in which, if you go back, in extreme right axis deviation, the heart moves more and more to the right. So it goes away from lead one, so it becomes negative, and also away from AVF. So AVF will be more negative. So both leads are negative, and this is called the extreme right axis deviation or severe right axis deviation. Let's see it. Yes, this you will find the lead one is negative, so the heart moved away from it, and also AVF has a more negative direction, so the heart moved also away from AVF. So in this situation, there is a severe right axis or extreme right axis deviation. In extreme situations, moving the heart towards the right side. So what is the differential diagnosis of right axis deviation? Any situations that cause right ventricular hypertrophy, dextrocardia in which the heart, the cardiac apex shifted from its normal left-sided position to the right side, presence of pulmonary embolism causing right ventricular dilatation, and also right bundle branch block, as we will see its morphology in the coming videos. So to summarize this, the presence of left axis deviation, lead one and AVF are antagonizing each other. Looks like they are in conflict with each other. So this is left axis deviation. In right axis deviation, both lead one and AVF looks like they are shaking hand with each other. So they are from the right people, right axis deviation. And in extreme right axis deviation, both lead one and AVF are negative. So this is extreme shift or deviation of the cardiac axis to the right side. I hope I have made it more simplified. I want you to know that the electrical axis gives me an idea about the position and imagination about position of the heart inside my chest cavity. Is it in its normal position? Is it shifted more to the left side, or it is shifted more to the right side? So it gives me an idea about certain pathologies as we have mentioned in this video. I hope I have made this concept more simple. Happy to be with you in this video, and in the coming small series of videos we will discuss the different parts of the ECG waves, segments and intervals, and know what is normal and what is abnormal, and what are the pathologies that can we diagnose using this. Happy to be with you during the lectures of this week, and thank you.